They feel ashamed. They feel there's their fault. They don't know what's happening.
Even their marriages fall apart. I think the least you can do if you love your partner is to try to understand what she's going through. Why is she getting hot flashes? Why is she always complaining of a headache? Why is she always in a bad mood? What is going on? I want to know. I mean, is it me? Is it her? What is it? There is no pill, no supplement that is going to replace a healthy lifestyle. We are seeing a lot of women getting myocardial infarctions at such young ages as in their 50s, even their 40s.
You would have thought that the HRTs are prescribed mainly to deal with the symptoms, with the hot flashes and all that, but I realized that the cardio protection
is one of the biggest benefits it has, as well as bone health. I can give you an example of a patient that I saw once in her 60s. I think she was about 64 at the time. And she came to me because she was having vasomotor symptoms. She was having issues with mood swings. She was having issues with insomnia. I was a little adamant about giving her the HRT, but I decided to give it to her and educate her. I saw her a year later.
I just want to pause for a moment and ask you to consider subscribing if you haven't done so. If you know of someone that you think that this type of content could be of value, please share and share the word of health. Let's change the concept of health. Thank you. Thank you for tuning in. Please give a like, subscribe, and share. And now back to the video. Welcome to the Dr. D Exchange. And this episode, we have a friend. This has been almost how many years?
12 years, man. That's a long time.
12 years since we met.
Yeah.
Wow.
And we certainly have evolved. Definitely.
But looking the same.
Yeah, of course we are.
A decade. What's a decade like?
Yeah, what's a decade, you know?
10 years.
Nothing.
So I'm going to let you off the hook just because you're my friend. So I'm going to ask you the same question I ask all my guests here is, please introduce yourself and tell me something that you would like the listeners to know about yourself.
Okay. Well, first and foremost, thank you very much for inviting me to your podcast. I'm very honored to be here. My name is Dr. Lillian Bowden. I am an OB-GYN. I did my residency at St. Thomas Hospital here in Panama, which is one of the biggest referral hospitals that we have in the country.
Yes.
And we get, the best formation here in our country, and what I like about my profession, which is being an obstetrics and gynecology specialist, is actually being able to accompany women in all the stages of their life, beginning from their teenage years all the way up to menopause years. So that's really gratifying for me because it's something that I really wanted to do, despite the fact that it wasn't my first choice.
Okay.
I always drifted towards pediatrics at first, but then when I did general practice, which is where we met, I really fell in love with the obstetrics and gynecology profession, and that is why I am here today.
That is amazing, and I have to thank you because you've always made me look good. When I refer you to a patient, they just have the best words, like best feedback.
Oh, that is so sweet. Thank you so much.
And it's true. It's no, thank you. Because like, doctor, you are the best. I'm like, I know, because I'm surrounded by the best team of professionals. I've worked with different gynecologists and OB-GYNs. They are good And the team, the personnel that I choose is because I trust. But
Of course.
since we met and you decided to go and do the specialty, I just said, like, whenever you finish, and we always talk about that,
Yes.
we have to continue working together.
Totally.
And you just evolve. It's as everything in life. You do your specialty and you evolve as a person, as a doctor. And it's been a blessing to my practice, able to refer my patients to you every time I have the chance.
Well, like I said, I feel really honored, to be trusted by you as a GP, as an important member of our medical force here, especially the fact that you receive people that come from other countries that are scared, and that have no expectations of what the medical practice is going to be here. So for me, that's really admirable. And it's really cool that you have entrusted me with your OB-GYN patients. I really appreciate that. And I love serving them.
I really want to talk about that, about how is the medical healthcare, especially in the area of gynecology here in Panama, because, like you said, a lot of my patients, more than 98% of them are expats, and they have no idea. They have heard so many things about Panama. Yes, they have a good medical service, or it's a third world country. Like, where are you going? Like, how are you trusting your body in the hands of people that doesn't know what they're... So we're going to talk about that. But I'd like to go back a little bit further. What made you decide to become a doctor?
Well, basically the same cliche reason that we all have, like, I want to help people and, I want to be there for them. And I want to, I'm in love with the human body and how it works. And then as time went on, and you really find out how hard and how much sacrifice and how much it really takes to become a doctor, you fall in love with it even more, So I truly believe that I chose the right profession for me, because it's literally dealing with people and helping them through their health journey. Mm-hmm. In my case, women, wellness for women, and also, taking care of them when they're pregnant, which is one of my favorite things as an OB-GYN, pregnancy. Mm. And that it's extremely gratifying for me, to really be able to help them, to really be able to guide them through the journey that is certainly very scary, especially for first-time moms. And I can't imagine that for expats, like, really not knowing what it's going to be like here can be really scary. So in that sense, I try to be as empathetic as I can, try to listen to their stories and what their experiences were in their hometowns, and, try to do my best to make them feel comfortable and to take care of them the way that they should and deserve.
Absolutely. And one of the most scary things of being in a new country, different language, different culture, is trusting your body to a stranger.
Oh, yeah, totally.
OB-GYN, gynecology, that is, you have an intimate relationship with your doctor.
Yes.
So when you have to, like, when you find your doctor, because you could be good, but we were talking before the cameras turned on about the relationship with a doctor. You could be good, but if you don't click,
exactly, it's not going to work. I mean, you really do have to. I mean, it's not, as doctors, we are taught that we cannot relate to our patients, in a too intimate of a way, because it can kind of jeopardize your practice. But I don't think that's entirely true, because I have, developed relationships with my patients, and I think that it's just like family. I mean, you want the absolute best for everyone, and you have to get involved. You have to show them that you care, and not be, cold and dismissive, and really empathize. I think that's very important.
So on that same trend of thought, they come, they don't know culture, language is an issue, and a profession like gynecology, like I'm trusting my body to this new person.
And that's very hard because, I mean, we're talking intimate
Yes.
parts, of your body. And that is not something that you want anyone to be seeing, obviously. And it's, it is hard. Once you find your OB-GYN, you don't want to leave that doctor, because that doctor literally knows you inside out, So having to switch, having to make that adjustment in a new country, I can imagine how hard that is. And that's why I try to be, as comprehensive and empathetic as I can. Even for me, in my own experience, like my OB-GYN, she already retired, and finding a new one has not been, that easy. Even for me in my own profession, because like we said, we really need to click with, with our with our doctors,
Yes. And then you mentioned you wanted to be pediatrician.
Yes.
And then you like
drifted away from it. Yes.
During your internship or during med school, what made you decide to?
Actually, not during med school. I mean, I actually started med school wanting to be a psychiatrist.
My goodness.
It's so far away from what I'm doing right now. Yeah. Though I can certainly say that as an OB-GYN, I do, practice a little bit of psychology to a certain degree, obviously not professionally, because that's not what I am. Because women, and men too, but certainly women really want to be heard, really want to be understood. And that's very important when you do decide, to treat them, especially during perimenopause and menopause years, which are, years that are very difficult because of all the changes we experience in our bodies, all the hormonal changes and all the metabolic changes as well. So I think that's very important. But yeah, going back to the subject, I started medical school wanting to be a psychiatrist. And then as we started, going through the hospitals and really looking at all their specialties, I slowly started drifting towards the moms and babies specialties, like that's where I knew I wanted to end up. So the first thing I said to myself is I like pediatrics. I like working with kids. I think it's really cool. There are some hard parts, obviously, but there's also hard parts in any specialty. Yes. So that's when it began was actually in the internship when I really wanted to pursue pediatrics. But as a GP, I started working at another hospital here in Panama that's called San Miguel Arcángel. That also has a very big OB-GYN patient load. And I started working there as a GP. And that's when I really started falling in love with obstetrics and gynecology, particularly obstetrics at first. But then the doctors that I met there really, started talking to me and telling me, I think you would be good in this profession. I think you fit here. But at first I used to say that I didn't see myself as a surgeon. Okay. Like, doing surgeries, like long surgery, standing up and everything. And I'm like, I don't know. I'm not really sure this is what I want to do for the rest of my life. But as I started getting into it, as I started helping them with their surgeries, as I started, delivering babies and doing all these really cool stuff and hearing them talk to me, I totally told myself, I think this has, moms and babies in it. There's also the medical part. There's the surgical part, which I'm pretty sure you're going to end up loving, because every time that I assisted them with their surgeries, I wasn't bothered by it at all. I mean, I really liked it. And now I just love it. So I totally made the right choice in the end.
So within the medical calling, you have specific callings, which in your case, you thought it was psychiatrist, then like, oh, maybe pediatrician. But at the end, you see yourself just being this OB-GYN gynecologist. Like, this is where I fit. This is where I belong.
Exactly. And it's such a beautiful specialty. You literally help bring life into this world. I don't think there's any greater honor than that, honestly. I can tell you that, well, I already said this, but it's one of my favorite parts of being an OB-GYN. And obviously, being there for women in their journey, in different stages of their lives. And it helps me grow as well, hearing about all their experiences and, helping them choose the right treatments should they need it, or, trying to encourage them to keep a healthy lifestyle, which is also very important as an OB-GYN, not only for GPs, because most of the diseases that we handle, especially in both, gynecological and obstetrics diseases, actually start by not being in the best health possible, so that is something that we really do need to encourage people in general, but in my case, the women that I deal with.
And talking about preventing, it's all about preventive medicine. We are accustomed of a system that is, medicine is reactive. You come in when you're feeling a lump. You come in where you're feeling something is not right.
Exactly.
Preventive medicine is not as popular as it should be, which is the real type of medicine that we should be practicing.
Exactly. And I think we are lacking that here in Panama. And that is a recurrent complaint, actually, that we don't do much prevention. I think we need more family physicians, or GPs that are really into wellness. And we would go a long way. Also, colleagues in every profession, but I do have a lot of colleagues that do favor lots of prevention. I try to be preventative as much as possible. Like, for example, when I speak to my teenage patients, I try to teach them how to examine their breasts. Even if they're young, it's very important for them to know their bodies. Not only teach them about the menstrual cycle, what to expect when your first menses come, what changes are you going to see, it's a whole deal. It's about trying to get them to be aware that preventing starts from the very beginning of life. And we see that actually from the womb. There are studies that show that women who had gestational diabetes or any metabolic, diseases can influence on their child's well-being in the future, especially diabetes, so that's something that we really have to teach them, that we really have to, get them to understand how important prevention is.
And that is part of the holistic approach.
Exactly.
In your case, as a gynecologist, you focus most of your practice in female parts and looking at female health.
Exactly.
But then, as you just mentioned, things like preventing diabetes, high blood pressure, cholesterol, a good diet, that is part of preventive medicine in general that will affect your women and your practice.
Exactly. And, in the end, OB-GYNs become women's GPs, and we need to be able to look beyond just the female parts. we need to be able to advise them on, for example, high blood pressure or any cardiac or endocrinology, illnesses that need to be addressed. And that's something I try to do in my practice a lot. Like, obviously, make them aware that those things need to be taken care of and you shouldn't wait till the last minute until, particularly with high blood pressure, which we know is the silent killer. Yes. That's something I really do try to bring to my practice, a holistic approach, like you said.
Super, super important. And to your point, in your case, you see a lot of younger women during their pregnancy, childbirth, and all that. In my practice, I see a lot of expats, and a lot of them, although lately been coming a lot of in their 30s, 40s, but normally is people that have retired and are coming to live here in Panama, yes. And that's around 50s, 60s. How prevention would look at that stage?
Particularly in women with menopause, we have to be really careful about teaching them about, for example, hormone replacement therapy.
Yes.
And how much we have evolved from what we knew in the past. How much we have learned about its true benefits, especially in women within the first 10 years of hitting menopause, cardiovascular benefits, because it's not unknown, the fact that as estrogen declines, so does our heart health. So that is something that we need to take into consideration. Also, bone health is very important, to consider in women during perimenopause and menopause years. Like, really focus on good functional exercising, fortifying those muscles, making them stronger, giving them, advice on the best lifestyle, best diets, not diets. I mean, learning to eat adequately to get all the nutrition that you need, supplementation if necessary. But those things are very important to teach women, because there is such a huge difference that we are seeing now in women that really embrace that, women that do get the HRT that they need versus the women. You can see it in women in their 70s and their 80s that their health is so declined, because they didn't get this information back then. And that is something that I think as gynecologists, we really need to teach our women about and try to, debunk all the myths. Obviously, there are contraindications to those therapies, but if you evaluate our women correctly and you teach them about the benefits of HRT, it certainly goes a long way for them, obviously paired with a healthy lifestyle. And, nowadays we are seeing more women above their 60s, looking that they're 40, and it's because they're really embracing the healthy lifestyles that they need to, follow in order for them to live a healthy, long life, hopefully.
I've seen that so much, because, again, my patient base, most of them are above their 50.
Yeah.
50 and above. And HRT is I would say, the number one question or concern for them, because of all the perimenopause, menopause, hot flashes, all the symptoms that it's affecting their lifestyle.
There is a huge list of symptoms, because to be honest, it wasn't something that was giving the importance it should have been given, in studies done, up until now, in, where we're really advocating for women's health, and where we know so much now about symptoms that you never would relate into perimenopause, and that has made such a huge impact
Other
on women's
doctors would
health.
just disregard like, it's
Yes.
old age. That's old age. It's natural. As you
Yeah.
age, your body's going to act this way.
The change of life,
Yes.
which is what many people call it, And unfortunately, there are some colleagues who are still afraid of it, Not to speak illy of my colleagues, but sometimes we do need to open our minds
Yes.
a little bit more and try to read about it a little bit more. Just, try to give it an opportunity, try to educate yourself, because in the end, educating yourself with the right information, obviously, because you can find any very, very, how can I say it, very bad redacted information online, and not looking at the right sources can really play a detrimental role on what patients think about different treatments, not just HRT.
Yes. And like you say, paired it with a holistic or a healthy lifestyle,
Yes.
like wellness, your nutrition, your physical activity, sleeping, stress management. It's things that seem simple, but they are important at the different stages in life.
Exactly. I mean, I think it all comes down to that in the end. The healthy lifestyle. Like, people look at us and say, that's all you have to say? Like, healthy lifestyle? Like, you talk about that at like it was so easy, like it was, the global treatment for everything, but it's just so important.
Yes.
There is no pill, no supplement that is going to replace a healthy lifestyle. And that is something we all need to embrace, even us as doctors, because sometimes we are not in our best health wise, but I think we should try to be as much as an example as we can for our patients.
I think that's a problem in our healthcare system, like globally.
Yeah.
We pay more attention, or we prioritize medication over lifestyle.
Yeah.
And we say like, yes, lifestyle, it's okay. You can do it. You have to do it as a complement of this. This is the treatment. This is the backbone of your treatment.
And that's where all the big pharma conspiracies come from,
Absolutely.
Like they are benefiting from people's diseases, That's what people think. I mean, but the truth is, healthy lifestyle is the global treatment.
Yes.
For everything, in your case, you also see men, and I'm pretty sure that is something that you advocate for them as well.
Yes. And again, this is the soul of my practice. It's lifestyle.
Exactly.
As the treatment, and then we complement with the medication, because there are the two extremes. Like, oh no, forget about lifestyle, that doesn't work. Take this medication, is this, and if you have this side effect, this is a medication for this side effect. And then the other school of thought of like, no, medications are the devil, and
Yes.
pharma is the devil, insurance company is the devil. But then if you match both, and my practice is based on use lifestyle as the base and complement when necessary with medication.
Exactly.
Because it was created and it's useful when it's necessary. But when you depend on just medication, there's a problem. When you ignore the medication and use just lifestyle, there is a problem. So you have to, number one, know your body. Talk to your doctor as I call it like healthcare partners.
Exactly.
Work together and use, if needed, medication, but using lifestyle as the treatment, the principle.
Exactly. And also for diseases, actually now polycystic ovarian syndrome has a different name. And I think it's a lot more appropriate, like polyendocrine ovarian metabolic syndrome, because it is multifactorial, all of these little things help us treat our women better, help us guide them better, help us make the lifestyle changes that they need and not just depend on a birth control pill, because that is not the treatment. You know, sure, it'll help you see bleeding every month, but in the end there, you're not treating the root of the problem. And the root of the problem has to do with a healthy lifestyle.
Absolutely. And then again, with the perimenopause, menopause, there's a lot of psychological implications involved. Is women feel that they feel ashamed, they feel there's their fault, they don't know what's happening.
Even their marriages fall apart.
Yes.
And that is very sad, you know, because there is not a true understanding about why women go through these changes, and men should educate themselves as well. Like, I see a lot of men now, well, I wish it were more, honestly, that speak about this, you know, and try to empathize a lot more with their spouses and try to really understand what menopause is, because you guys don't feel any of it.
Yes.
And I think the least you can do if you love your partner is to try to understand what she's going through. And a big part of it is educating yourself. You know, why is she getting hot flashes? Why is she always complaining of a headache? Why is she always in a bad mood? What is going on? I want to know. I mean, is it me? Is it her? What is it? You know?
So that education, what would you suggest? Because there's so much, like you said first, misinformation or ill-redacted information out there. So you would do what, counseling, or going with your spouse to the appointment with the gynecologist?
That is one way to do it, but also GPs should also, you know, speak about this to their patients and to their spouses as well. Obviously, us as well. It wouldn't hurt for women to bring their spouses so that they can really hear about it during consult, and provide, you know, the right literature for them to read and to understand what's going on.
But you're right. Like, EGPs should be more informed.
Yes.
And ready to just provide the right information.
Exactly.
Do an appointment with both of them. Sit them down and just talk to them, educating. This is what, unfortunately, the current healthcare system doesn't promote that much.
Exactly.
Because we are in, like, you have this amount of time.
You have to, exactly. And it does not only happen here in our public environment. It happens all around the world, because I've heard podcasts of other medical doctors, you know, complaining about this. Like, I only have 15 minutes to see the patient. What can I do in 15 minutes? No, and it's not good.
That's so true. Like, again, my patients, that is their number one complaint.
Exactly.
Like, they come from a system where doctors doesn't have time. And it was designed like that. After a while, you start with a mission. I'm going to treat each patient like it's my parents and all of that. And then you realize you have 15 minutes. And when you least realize that is your default mode. You're in a managing time.
And that actually makes doctors burn out. Like, this isn't what I signed up for.
Yes.
You know, I signed up to help people. And I'm getting frustrated because I cannot. And there are some points in which you snap. Wow. You know, you really do snap, and people don't see it, you know, with kind eyes.
Yes.
Many times, you know, especially in the public environment.
Now you're mentioning the public environment. What is the difference here in Panama between the public system versus the private? The private? Talking about the gynecological aspect of it.
Certainly the access to, you know, testing and medication and proper, you know, care in the sense of when you're in a public system, like we just said, you know, you have very little time to really talk to the patient, to really examine the patient, to really educate the patient the way you should. versus private practice, in which you do have a little bit more time and you are certainly getting paid for it to, take your time to educate the person and to really examine the person the way that they deserve to be examined. And I wish there was some way we could change that in our health system, like have, income enough to have enough doctors to see the patients in the public practice. Because sometimes we do not have enough doctors, for all the volume of patients that we handle. And that is one of the biggest problems that we face.
That's oversaturated.
It is. And there's so little personnel to take care of everyone, apart from, the tools that we use to work with. I mean, sometimes, for example, when we do surgeries, not only gynecologic or obstetric surgeries, and surgeries of all types, general surgeries, orthopedics, neurosurgery, all of those things. Sometimes we do not have the equipment, or, simple things like sutures that we need to really do our work adequately.
Wow.
And that is something that I believe our government doesn't really give that much importance to, as does happen with education as well. And that is just sad, because I think that's the heart of the country, its education system and its, healthcare system. And to see that being recurrent in third world countries, and not only third world, I mean, we're seeing it everywhere.
Yes.
That is so sad. Like, we really need to redirect our priorities in order to get people that do not have the resources the proper care that they deserve,
So then we go, and if we cannot treat them as they deserve, so we micromanage. So we don't have the resources, we don't have the time, so we're just gonna prescribe. See, as much as we can, prescribe and
just take this.
And continue.
Come see me in 3 months. Next. Yeah, all right, take this. Come see me in 2 months. Next,
Treating the symptoms the best as we can. Take away the pain, take away the bleeding, take away the discomfort.
Just picture it. A woman from the countryside who only eats, yuca and eggs every day, because that's what they grow and that's what they have in their backyard. How are you going to teach them about a healthy diet if they can barely survive with what they have, And this is all things that I wish would be different to give them the health care that they need. So you can really imagine the scope of the problem, and that happens a lot in public practice. Like, you try your best, but in those cases in particular, you really should take your time to make them understand why it's so important. Because literally they have to decide if they're going to eat, or if they're going to, transport themselves somewhere, because that's all they can afford, And it's very sad.
Again,
it's very sad.
In those cases, and in all cases, again, the best as we can do is arm them with the tools, in this case, education, on how they can live as healthy as possible. So at the end is building up that immune system, building up that body to be as strong as possible to resist and to defend itself against the situation. You have the resources, or if not, try to do the best you can to fortify your system. Try most you can to promote holistic wellness.
Exactly.
Education.
Yeah, no. And we see it a lot in our social security system as well. Part of the public aspect of our healthcare here in Panama. Like, for example, patient needs set medication and there's none. They go to different clinics, public clinics, to try to get the medication, and there's literally none, and they have to see how they can scratch the money to buy the medication that they need. That's just not acceptable. That is something that I really wish the government could prioritize, because that really doesn't help us, as physicians, give them the best care that they speaking in the part of the medication, if they do need it. But again, sometimes they do not have access to proper food, for them to really have a balanced nutrition. And how can you demand it if they have no access to it, So it's really a hassle in the public practice to try to get these patients to have the best, care and the best health that they possibly can.
Speaking about nutrition, in the later stages, 50s, 60s, what would you say that would be the best nutrition if you had the means, if you can decide what to eat based on where you are in life?
I think proteins are very important for all age groups, particularly, we emphasize that a lot in perimenopause and menopause, and in obese people as well. That protein is what we need to build our muscles, and proteins from different sources. I know that there are many vegan people who struggle with this sometimes, but there are also nutritional specialists that can really help them get that protein intake that they need for this. But that is one of the, the best food groups that promote healthy bones and healthy muscles. Healthy fats are also very important. Omega-3s for heart health, especially. That is something that certainly in my practice, I try to recommend as well. But proteins are like the building blocks of our muscle, muscle function, and, ultimately keeping our bones healthy as well.
And you mentioned this again about heart health, especially after menopause, perimenopause, because your hormones are not there anymore to give you that, to keep you, to watch your back regarding your heart health.
Yeah.
In those cases, at this age, how we take care of our cardiovascular system?
Certainly, if you can, be eligible to receive HRT, that's a very big instrument for us in women wellness, apart from promoting a healthy lifestyle. And there are other options that we can explore for, vasomotor symptoms, as we call it, the hot flashes and all of those things. But in women that do, benefit from HRT, that is one of the biggest resources that we have, apart from promoting a healthy lifestyle, to really protect women's hearts, because we are seeing a lot of women getting, myocardial infarctions at such young ages as in their 50s, even their 40s, because of early perimenopause and all of those things.
You would have thought that the HRTs are prescribed mainly to deal with the symptoms, with the hot flashes and all that, but it was not realized that the cardioprotection
is one of the biggest benefits it has, as well as bone health benefits. And especially if you take it within 10 years of, beginning menopause, that's when you really see the benefits. And you really have to be careful with beyond that age, that there are some studies that say that it can increase your risks of heart disease. But, I think we should tread carefully with that and really individualize every case.
Absolutely.
Because I can give you an example of a patient that I saw once in her 60s. I think she was about 64 at the time. And she came to me because she was having vasomotor symptoms. She was having issues with mood swings. She was having issues with insomnia and all of these things that entail menopause. And she was in her 60s. You know, many people say that they go away after a certain age,
Yeah.
but not necessarily. I mean, there are some people that still experience them. And I was a little adamant about giving her the HRT, but I decided to give it to her and, you know, try to educate her on what symptoms and what, you know, medical signs to be aware of, if anything. I saw her a year later and she was a different woman.
Wow.
Like all her symptoms were gone. Like she was happy. She was thriving. And I'm like, my God, I mean, this really does work, you know? So obviously you have to individualize every case because this is not like 100% for everyone.
Yes.
You have to take a look at their history. If they've had breast cancer, if they had a history of thrombosis, you know, blood clots and stuff like that, because there are some people who cannot get it and need other options. But what is the most important aspect of our education, not only as gynecologists, but as GPs as well,
Yes.
is healthy lifestyle, functional exercising, building muscle, eating adequately, especially your proteins, getting the amount of proteins that you need during the day. That is something we really need to focus on, you know.
And then you mentioned individualizing the treatment. Again, not two bodies are alike. You could be eating the same thing, be part of the same family, but your treatment is completely different because your body is different.
Exactly. It's not a cooking recipe,
Yes.
you know, like you follow it to the T. No, it depends on the woman.
So based on history, personal history, family history, lab work, do you ask for specific labs to determine which tests?
Well, yeah. I mean, when you're in perimenopause, we can evaluate your ovarian hormones, you know, FSH, LH, estradiol to see your levels and really determine whether you're there or not. Cortisol levels are also something that we look at a lot. And obviously all the metabolic panel, because we don't limit ourselves to the hormones. You know, obviously the thyroid hormone is also very important to check. But we really do need to look at the blood sugar levels, the hemoglobin. We even need to look at the lipid panel, which is actually expanding now with, you know, ApoB and Lipo-A and things that are certainly teaching us that there are better ways to evaluate your heart risk than just your normal metabolic panel, you know. And that is something that we really need to do for everyone in every specialty, men and women, you know, alike. So yeah, that is something that I do order for all of my patients, as well as imagery, you know, trying to teach them about mammograms and breast ultrasounds if needed, which is also a big thing for patients when they come from other countries, but because that is not as accessible over there sometimes. Like you need to go through so many layers of, you know, of care in order for you to be able to get an image study of that sort. And here in Panama, I mean, it's not that hard.
So what would you recommend image-wise, and how often?
You know, there are lots of guidelines, but here in Panama, we tend to do, you know, your mammograms and your blood work at least every year.
Okay.
You know, to try to really get into terms with how you are health-wise, in a little bit more of a frequent way, as well as with pap smears, you know.
Yeah, that was another question, because I have been asked in many occasions in people 60 and above, like, doctor, do I still have to do my pap smears? How often do I have to do it?
Yeah, that is also a very recurrent question that we get. And that really depends on your desires and your doctor's desires. Obviously, it also depends on your previous pap smears. If you have a history of HPV, if you have a history of abnormal pap smears, should you benefit or not from extending beyond 65 years, your annual check of, including pap smears. And at least for me, I try to do it because I have seen cancer in older women that stop getting pap smears. So I'm very particular about that. I try to encourage them to keep getting it. But obviously that is the decision that you have to make with your doctor after you hit 65, which is what the guidelines say.
So 65 is
it's kind of a cutoff.
Okay.
But, I tend to advise them, depending on their history as well, to, try to keep on track of that.
So, doctor, where the people listening, where can I find you?
Well, I work at Pacifica Salud in Punta Pacifica.
That is a Johns Hopkins affiliate.
It is a Johns Hopkins affiliate, yes. And you can find me in Panama Fertility. That's the clinic that I'm currently working at. And I work with wonderful fertility doctors as well. And I personally am a general OB-GYN, so I do everything regarding that. And yeah, you can find me there, certainly at your service always.
Perfect. Do you have an email or does it have a number where like a secretary?
Yeah, you can call the central line, which is 233-2323.
Okay.
And you can certainly communicate with the secretaries there.
Okay.
And we can give you
Pacifica Salud?
Yes, in Pacifica Salud. And I am going to give you the WhatsApp number so you can put it in the video so that they can have that way of communicating as well. And yeah, whatever you guys need, I am available for you always.
Perfect. Is there the average waiting time to get an appointment with you?
Well, I mean, I think it's not like that bad. It really depends on the season.
Okay.
But it shouldn't take that long to find a spot. I'm usually there Mondays, Wednesdays, and Fridays.
Okay.
And in the afternoons, because I work in the public service in the mornings at Santo Tomas.
Public and the private.
Yes, I do work at Santo Tomas. But yeah, I mean, you can find me at the clinic Mondays, Wednesdays, and Fridays in the afternoon.
The fertility clinic or the Pacifica Salud?
Both. I mean, it's the same.
Oh, it's the same thing. Oh, the fertility clinic.
Yeah. So Pacifica Salud, Panama Fertility. That's the name of the clinic, and that's where I work.
Oh, okay.
Yeah.
I get it. Bowden, it's been a pleasure. Thank you very much for dedicating your time.
Oh, thank you so much for inviting me. I really do feel honored. Yes. And I am at your total service for anything OB-GYN related or anything else that any of your patients need. Thank you so much for referring them to me.
The question I always ask at the end, is there anything that we didn't discuss that you want the people to know?
I think another important point is mental health, that is disregarded. And in my case, particularly in women entering those difficult perimenopausal and menopausal years, like it is not given even the slightest importance that it should be given. Also in teenagers as well, because that's also a very difficult time of change. Trying to listen to them a little bit, understand them a little bit more, and not take it for granted, especially if there are some deficiencies that we might see, like, attention deficit disorder or any other thing that might be giving them a hard time trying to communicate what they want to communicate, what they are feeling, what they are thinking, I think that's something that we have to promote in every single branch of medicine, mental health. And we've seen it recently with some stories of people that have ended their lives because they were not listened to. So I think that's something we really do need to consider.
Yes, mental health is normally regarded as not real medicine for so many years.
I find that it's another organ that we need to take care of, if we can define it that way, but it's so important.
The most, if it was an organ, top 3
Yeah,
of importance.
I know. Yes.
Whoever knows me and which the patient I have referred to you when I say, but is she a good gynecologist? They won't let me lie. I've always said this. Right now, my daughter is 10. When she gets to the age, hopefully, it's going to break my heart, but when she gets to the age that she needs a gynecologist, that's going to be the gynecologist of my daughter. That's how much I trust you. I appreciate you. And thank you for being there for my patients. And hopefully this is not the last time we're having
No,
this
certainly not.
conversation.
We could, discuss more specific topics if you
So
would,
much.
Yeah.
Absolutely. So much to discuss. And we'll see each other again here
Yes, sir.
and to continue being you.
Yeah, you too.
Now we have a picture to take.
Oh, yeah, totally. You got it. You have to show it in the end, though.
Yeah, I'm going to show it.